Hello everyone, this is Dr. Christina Piña, and this presentation is on one of my favorite subjects, the vestibular system. This is just kind of a basic overview of how our vestibular system works and how our ears play a role in helping us keep our balance. Let's get started. There are three main systems in our bodies that help us maintain our balance. One is the vestibular system, which is in our ears. 2 is the vision system. And 3 is proprioception, basically knowing where your body is in space and being aware of self-movement and body position. The role of our vestibular system is to help to maintain our orientation with respect to the center of the earth and objects in our environment. So it helps us maintain our center of gravity, awareness of movement, and maintaining focus on moving objects or while we are in motion. It is made up of the inner ear organs, which includes 6 semicircular canals, so 3 on each side, and these are responsible for sensing angular motion. And then we have the utricle and the saccule, which are the otolithic organs, and those are responsible for linear motion. There are also a lot of central connections, including cranial nerves in the brainstem, the cerebellum, and the vestibulospinal tracts that run down the neck into the spine. So what happens when there is a problem with one or more of these systems? Well, you can experience vertigo, which is typically described as a spinning sensation, but it also is just a sensation of being in motion or that your surroundings are moving when you are stationary. You can also experience dizziness, lightheadedness, loss of balance, and veering while you walk, and you're also at a higher risk of falling. As I had mentioned before, your vision system is part of your vestibular system. So how are your eyes and ears connected? It is through the vestibulo-ocular reflex, or VOR, which allows you to maintain your focus when your head is in motion. So what does that mean? Well, when you are in motion, your eyes produce a movement in the opposite direction of your head in order for you to maintain your focus on your retinas. As you can see in the picture, if someone is focused on the examiner and the examiner turns the head very quickly, the eyes stay focused on the person's face. When you have a dysfunction in the VOR, when you turn the face, the eyes go with the head and then do a corrective movement back, which is called a saccade. This allows the images to slip off your retina, which causes you to have that sensation that you're still moving when you're not. When there is a problem or a dysfunction in your vestibular ocular reflex, then objects appear to bounce or move or even lag behind. So as anyone that has ever had vertigo can tell you that fast head movements can often trigger or exacerbate their dizziness or vertigo. So in the beginning of an episode, they may be moving very slowly or trying not to turn their head to look quickly because it causes them to experience some vertigo. Over time, your brain can often compensate for this dysfunction naturally. However, some people don't compensate, and vestibular rehabilitation therapy with a trained physical therapist can be very helpful to aid in this compensation process. So one question I get pretty frequently is regarding the crystals that are in your ear. These crystals are located in the otolithic organs, the utricle and the saccule that I had mentioned earlier. And what happens is that these crystals are actually naturally embedded in some gelatinous mass and sometimes become dislodged. They can become dislodged for a variety of reasons, including just advanced age or head injuries. But what happens is when they become dislodged, they can move into one of those semicircular canals. This makes that canal more sensitive to head position changes, and this type of vertigo is known as BPPV. BPPV stands for benign paroxysmal positional vertigo, and it is one of the most common causes of vertigo. The episodes of BPPV are typically very brief, but they can range from mild to very intense, even causing nausea and vomiting. These episodes are very often triggered by head movement, such as tilting your head back or bending down, rolling over in bed, or sitting up in bed. This type of vertigo can often be corrected with repositioning maneuvers, such as the Epley maneuver. BPPV mainly affects one ear. So, unfortunately, there have been some cases where the patients were being treated on both sides, and that's actually incorrect. It's not necessary to treat both sides. When you're treating one side, if you go and treat the other side right after, then you're actually being counterproductive and undoing the correction you had just made. In the very rare case that you might have BPPV in both ears, it is still recommended that you treat one side, wait about 2 weeks, and then treat the other side. Because again, if you treat them too close together, you're actually undoing what you're trying to do. I hope this presentation has given you at least some basic understanding of the vestibular system. It's a pretty complex system, and it requires several systems to be coordinated to maintain your balance. Another thing I wanted to mention is that vertigo is a symptom, not a diagnosis. A lot of times patients say I was diagnosed with vertigo. Well, you don't have vertigo as a diagnosis. The cause of vertigo is numerous, so sometimes it's a process of elimination to get to the root of the cause. But once we find the cause, then we can figure out what the best treatment route would be for you. It is really important to see an audiologist because we are the ones that do the bulk of the testing for vestibular disorders. That includes audiological testing as well to help with that diagnostic process. Thank you so much for listening to my presentation. Feel free to reach out to us if you have any questions. We're always here for you. Thank you and have a great day.